Welcome back to another episode of The Fireside with Jade. I'm your host, Jade Natasha Iriza, and I'm thrilled to have you here once again. In today's episode, we will continue our exploration of the law on reproductive health in Rwanda, this time focusing on the prevention and treatment of sexually transmitted infections, including HIV/AIDS. In today's episode, we will continue our exploration of the law on reproductive health in Rwanda, this time focusing on the prevention and treatment of sexually transmitted infections, including HIV/AIDS. Joining us today is a special guest, Aline Berabose, and she will share with us her insights and expertise, having worked with a number of women at different times in her career. I will let her introduce herself to the audience.
Thank you so much for having me, Jade. I'm very happy to be here. So as you mentioned, my names are Berabose Aline Joyce Ariko. I go by Bose, and I am a feminist activist and I'm a Femtech Entrepreneur running a telehealth solution called Luna. It's a platform for women to be able to access quality healthcare, but we connect them with various experts in women's health from the first menstruation to menopause. So we deal with different issues that women face, like endometriosis, PCOS, infertility, HIV, and all other infectious disease. I'm very glad to be having this conversation with you today.
Okay, but why do you think it is important to be tackling or focusing or even giving a slight attention to all those challenges you just mentioned? Basically, why are you passionate about this?
I'm very passionate about women's health. One is because the current general healthcare is not it's general health, right? So it's very less likely that a person could go to the hospital to know more about their period if their period pains is normal. But as a woman growing up, I recognize how women's healthcare from our periods is mostly a taboo and a stigmatized conversation, and this really prevents us from learning more about ourselves. And this is why I wanted to leverage technology to break that silence and to break that stigma and that barrier for women to be able to know more about themselves, because there's a growing rise of issues that women face, like infertility, and that's something that I want to stop.
So thank you for joining us today. I'll start by a question. Did you know that women are about twice as likely to develop an HIV infection than men are when engaged in a heterosexual act? A woman is more likely to get HIV from her first sexual encounter with a man than her male partner is. The plot twist is that while HIV/AIDS prevalence, new infection, and AIDS-related death are by far higher among adult women than men, mostly due to the ways that women's bodies are different from men's, but research also finds that more women knowingly transmit HIV/AIDS to their women partners than the other way around. Aline, do you think many women are aware of this in Rwanda?
I don't think so. Which is why I'm very happy that there's a space like this where they can get the knowledge and information about it. But I think generally, as a person who's working in healthcare for women, it's always surprising to see how little we know about health, particularly when it comes to our health and how it affects us, because a woman is a very, very vulnerable patient in general. Our bodies are very, very sensitive. But I would say that there's now more, particularly sexual reproductive health information and activists and organizations that are doing this. So hopefully we will see a rise of information coming through, and also normalizing this, and education would be great. But so far the information is really, really quite low.
Do you think it is the information that is lacking, or the willingness to actually take in the knowledge that is lacking?
So because like sexual reproductive health in general or sexual health exists in a very stigmatized and a taboo society like ours, you will find that so there is like taboo of discussing certain things, and then there's people who are not, how do I say it? There's a word for it. It's like, if I'm conservative, for instance, right, or I have a certain belief that says, I have to protect myself until I'm married, I'm doing this, then you are convincing yourself that maybe I don't need to learn about STDs and HIV. I don't need to learn about contraception and all of it just because like I'm not currently sexually active. And this is a conversation we often have even with our members, right? Because of a lot of ignorance and denying to expose yourself to information. And most people, particularly in a conservative society, thinks that sexual health education is about promotion of sex practices. But knowledge is knowledge. Knowledge is power. You need to know things even though you're not practically like sexually active, for instance, right? Mm-hmm. Even if you're married and committed to one particular partner, this is what I was saying, that as we encourage our members to constantly do regular checkups, as a married person, because you're on your own. You're a woman, you're in a committed relationship, but who says that the other partner is also committing to you?
What do we do of the trust?
But I think regular checking is nothing about trust.
Mm-hmm.
I think we need to move to a space in which where we respect our health in any way, right? Like like there's so many ways that someone, for instance, can get infected. Mm-hmm. That doesn't mean like your partner probably cheated or in different ways, but isn't it better knowing than not knowing?
Right.
Because the ignorance can cause so much harm, mm-hmm. And we need to be able to separate both those things. Like you need to check on yourself and not just about HIV or any other STDs. Like you need to normalize. We need to normalize going to check up yourselves and be like, how am I doing in terms of my reproductive entire health system? How do I have any infections? Do I have this and that and that and that? I think it's a new culture we really need to cultivate.
But do you think we are scared to find out? Because it's all good, but do you think we are ready? Like sometimes they say there is comfort in the oblivion, right? So do you think women are actually ready to face themselves and be like, okay, I may or may not be getting this from him, but I have to know, and it's above me wanting to please him in any way?
Yeah. I mean, it's true what you're saying. I mean, years working with women, I think women are really scared of knowing, of finding out, and they're mostly scared about their body. Like a woman would have an infection or something, a small bump on her sexual part, and they will still not be able to be like, maybe I need to go see a gynecologist and ask if everything is okay. And they would just be scared for the simple reason of that. And also the shame of just not being comfortable with their bodies, which is insane because you live with your body. You're constantly interacting with your body. I'm still looking to understand more where this fear comes from, this shame around our bodies come from. I mean, obviously we, things like taboo and stigma we talked about are part of the reasons why, but I think we really need to start like educating ourselves on like how important it is to just know things. Like you can't see something. I will give you an example, right? So women, we know all of it. Once you reach a reproductive age, you start menstruation up until your menopausal years, right? And there's so many symptoms around like the menstrual cycle, right? If you in your PMS and you're having like headache, cramps, or backache and ABCD, if you have severe period pain and all of these things, unfortunately, some of these symptoms can also be indication of like serious health conditions, right? Like someone could have period pains, but they also have endometriosis, and this can lead to infertility, and this can lead to more issues and issues and issues and issues. And when we don't ask ourselves, like, is this really okay? Like, yes, I'm having pains, but is this normal? Is this a normal pain? Is there something wrong? Who do I need to ask? How do I need to check, right? Then we're just exposing ourselves to real serious issues. Like, therefore, now you're married, you're trying to have kids, and they're like, hi, sorry, honey, you can't, you know. And that's something that you could have easily prevented from the beginning.
Now let's go back to the transmission of HIV from men to women. And well, usually the hardest part when it comes to the legal landscape is to be able to prove the intent, whether this person knowingly wanted to transmit the infection to this other person. But however, the law of reproductive health still provides for such instances. It's Article 13 says that every person has the obligation to protect himself or herself and protect others against sexually transmitted diseases. And any discrimination or stigmatization against a person infected with HIV/AIDS is prohibited. And according to its 117 article of the Rwanda Penal Code, intentionally transmitting an illness likely to cause disability is considered an offense. And if someone knowingly infects another person with a sexually transmitted disease, they can face imprisonment for a term of at least 2 years and a fine. In case where the transmitted illness is incurable, the penalty can be imprisonment for at least 20 years, accompanied by a fine. However, proving intent can be challenging, and making it crucial to have this makes it crucial to have strong evidence and legal support. But as someone who advocates and works with women daily, how do you advise? Because you're saying women should have more agency. That's exactly what you're saying. They should take matters into their own hands. And that's where it is difficult for them to prove that actually this person, it is their fault. Sometimes when we find ourselves in a bad situation, we intentionally put the blame on ourselves, or the society does it for us. So how do you think women can go about this, and how do you think they can assemble evidence or support in the list?
I think I will come back to the same thing. Just normalize doing regular check-ins. Whether you're with a partner or with no partner, just constantly normalize it. Every once in a month, end of the month, just go do check-in and know, like, how am I doing? At least every 4 months, okay? Like, let's say three times a year. Because in that case, you can even be able to provide evidence. Hey, here are my test results from 3 months ago, and here is the people I was with, or if I slept with this person, and you can be able to prove that because you already have evidence. And this is it's really crucial just to be able to do regular check-ins.
But what about the other emotional part of it? For example, as someone who works with women, you probably hear from a lot of their dilemmas. So do you think there are signs that you could tell that this person wants to harm you in one way or another? Or is there a way you can protect yourself from it? Because it's easy to say, use a condom. Or do you think there is any other way you could protect yourself? Even before you engage with this person, you are able to tell, like, hey, I cannot trust this person. Or should we just say don't trust anyone?
No. No, we cannot say that. I think women to another woman, I think my recommendation would be don't be lied to, and I think I encourage very, very much all the time, if you are with a person and you ask them, when was the last time you got tested, and they're like, no, I don't taste myself, I'm clean, I'm doing, like, it's not about that, if someone...
Let me tell you, there's this other time someone said something so dumb. They said, me, I'm always going with girls who are clean that I trust.
I heard that before, and then that's like the most ignorant, stupidest thing I've ever heard, you know. And there's people who are like, oh no, I think sex is much better without a condom. Is that person your committed partner that you can even trust to begin with? Like, you just literally picked a person on the way. You don't know them, you don't know their history, you don't know who they have been with. So do not. I think women are easily manipulated. Like, don't allow yourself for people to just blush you off or gaslight you into thinking like if you ask them to like to bring test results, then all of a sudden you're saying something that's not there, right? Be that person who cannot be manipulated. And I think my advice around that, the moment that someone is not able to do something so easy, that's because they're trying to hide something. So we need to take matters into our hands. And being ignorant, yes, is a bliss, but it's also very dangerous. Yeah.
But I'm still not satisfied as a woman myself who is out here, you know, and I'm trying to meet this person, know them better, and here we are, ready to pass to the other next stage, which is sexual. Then how do I approach the conversation? Do I just tell him, okay, hey, before we engage in this next step in the relationship, please bring your test? Or basically, how do I go about this?
Yeah, it's very easy actually. I feel like, yes. I feel like if you're at the point where you're discussing someone and you're ready to have sex, and they have to be like open communication. You need to be able to open up. And I know that a lot of times we're not taught how to have these conversations, so it can be quite hard. But we also, this is 2023. You don't even have to go to the hospital anymore, for instance, to do HIV tests. There's self-testing kits that you can buy for 500 random francs. You could bring them both tests and be like, hey, before we do this, I bought this self-testing tools, and I just wanted to, to do a test, and I think that's actually should be one of the indicators to know, like, if you're with the right partner or not. If they're like, oh, that's a really great idea, and it needs to apply even with condoms, right? You could be with a man and he that night or that day they didn't have a condom to them, and then you'd be like, I actually do have a couple of condoms by myself, would you like some? And then not to, because I hate the idea that women will always put our health in the hands of men to decide for us. If does he want a condom, does he not want a condom, is he ready, is he okay with getting tested? Like, he has his own health, and you're also like your own being, and if we don't take matters into our hands, oh my God. Yeah. Okay, now, but what if the harm is done? What do we do now? That's the thing, I think one of the things I always, because these are things that happens on a very regular basis, you need to be, now we know that there's a law that protects us, and which I really appreciate, and to be able to have the courage to report to the person, to find the right support system. There's so many focus groups with either, like now in Rwanda, there's so many projects around the country where you can find community, particularly of women going through that, and HIV in particular is starting to be like, people are starting to open up, right? I remember growing up, if someone would have HIV, it would be an abomination. No, if they were suspected. Yeah, you lose weight and everybody was like, oh my God, she has lost weight, it's HIV. And people, I know a child, when I think about it, it breaks my heart, in primary, that people couldn't eat next to or sit next to because they were suspected to have HIV, which is insane. Because first of all, this is like how crazy the society we live in. But it's good to see that with so many campaigns that have been done, organization and foundation fighting for more awareness, these are conversations we can have, and also that there's medication now, right? And I think back then HIV used to be scary because there were no treatment. It was like people would die on a daily basis, but now we have treatment. You can have treatment on a regular basis for free, easily accessible to a closest clinic, using your Mitwell or private insurance. So I think it's important.
No, actually, no. HIV medication is not covered under insurance, but you have a point. It's for free in public hospitals.
Yeah. I mean, imagine that. And there's like so many clinics around.
Yeah. So now, Aline, do you think that women are generally believed and supported when they decide to sue men who sexually transmit disease to them, especially in case where it's incurable? And do you think our society is accommodating of people who speak about such abuses? Yes, it's a lovely idea to tell people, you know what, come out, you're supported. But okay, once I'm out, is it cold out there, or am I getting hugs?
It's a tough world out there for women, and particularly for women who stand up in issues, either if it's HIV infection or rape or abuse or harassment. There's what we call victim blaming.
Right.
The society is always going to find a way to put it back on you, as if you contributed to your own issues. But looking at the positive side, I mean, we have gender rights activists, we have lawyers who are like really committed to empowering women and supporting women cases. You will probably not have the whole country cheering you up, but what I promise is that you would have women and people and men who are ready to back you up, and that's pretty important to know.
Is that where communities like Luna come in?
Yeah, definitely.
Go ahead.
Yes.
Tell us about it.
So I run a telehealth platform for women to be able to access experts in health, such as OBGYNs or gynecologists, therapists, and many, many others, right? But we also provide a safe community platforms, right? So you can easily find other women who are working through life the same as you. If you're HIV positive, you can be able to find the same community on the platform. If you're going through endometriosis, which is severe menstrual cramps, to like sojourning, I guess, with that kind of community, because it's important.
Right. So what ways do you think our community could be bettered into accommodating such examples, or do you think it's up to society and people? If so, how can it be done?
Definitely, it's up to us, because we have the right policies, we have the right systems. It's just time to break silences about these issues and make it have normal conversations. I think even between friends or family or colleagues, to be able to have conversation about our health status, what we're going through. Because when we don't open up, for instance, right, you could find that if you work for a corporate company, that if the company knew your health conditions, they could easily know how to provide facilities. But when we don't speak up, there is no support system. And it all starts by breaking silences. I think we have to unlearn the shame that we accumulate by ourselves and started normalizing conversation about reproductive health, a disease or not. I think it's important, because one of the things is that the most stigmatized and taboo topics are also our everyday, every single day life circumstances. So what are we actually talking about if we're not talking about the most essential things about our lives?
Since we're still talking on the betterment of ourselves and society, since you're in the business of making reproductive health even more accessible to women, I'd like to ask, as a woman who how easy do you think it is to access treatment for sexually transmitted infections in Rwanda? And is it affordable? Is it covered by insurance? For instance, through Luna, do you think someone can easily and safely know about where they can access HIV treatment pills, for example?
On Luna platform, we don't work with insurance, so our members are private, and we try to provide information. But I think we tackled this earlier. I think it's good to know that you can easily go to a local clinic and get your medication or get tested. But there's also now so many telehealth solutions, right? E-commerce for women, where you can order testing tools or order different medication. But there's also, what was I going to say? There is, there's like this, it's called, like a locator kind of a thing, particularly for HIV positive people. You can be able to track like your nearest hospital wherever you are across Rwanda.
Via Luna?
No, it's another. Oh my god, I will share it with you, and then probably your listeners can be able to have it in the either in the bio description of the episode. But there's like innovations like that where you can be able to track where it is. There's now like but for us, how we help our members is that you have a personalized doctor who's working with you, like either if it's a nutritionist, if it's a general practitioner, to really help, even if there's a slight changes in your eating habits or skin or mood. They can be able to know like, okay, so what's going on and how can we be able to help you. I think there's so many innovations, but the beginning is that like it's good that we have the public clinics accessible and close to everyone, but you can always also leverage all of this technology.
It seems there is a lot of options out there, but why do you think people are not aware of it? And what can we do to actually make it more, make them more accessible to the common woman mostly?
Yeah, I think the conversation have not made it into mainstream, to be honest, right? I think as a person who's a founder, we're still even fighting against the idea of promoting our work, right? Because some of the things that people don't know, like, I mean, digital like internet is now like one of the ways to share news of everything you're doing, but a lot of sexual reproductive health content are censored on social media because you can't use words like vagina, sex, labia, like even if you're correct, like scientifically, biologically, you're still censored, which means there's still a gap between how information is shared. But once we fight that, I mean, we can try to go mainstream and advertise the work and promote work. You can't just put a pull-up banner in the middle of the city about most of the things that we want to advocate for. But it's only the beginning.
Still on the recommendation part, how do you think women can be empowered to speak out and actively engage in their own healing, for example, through therapy and engaging with people who are on the same journey as them after experiencing such traumatic events?
I think therapy is really important. At least in my case, I think I really respect therapy in to be able to grow, to be able to heal, and finding community. You need to be able to find people who understand you, who understand where you're coming from. But also applying like different habits, like self-care routines, because it's a very traumatic event, and it's very challenging for everyone. So I would recommend start listing down what actually really makes you happy. What are the things that really brings you joy, to do that, connect with other women or men or people who in the same sector as you, and then move on.
Right. Okay, so something I'm getting out of everything you told me is that there is more for awareness, literally, and community initiatives that promotes for wellness and feeling safe to share and to belong. And then resources are needed to be put in education, in support, in counseling services, and honestly, spaces such as this podcast are actually meant to make it possible to have a world where women are encouraged to seek professional help and build a network of support that aid them in healing processes and contribute to their overall well-being. That's why we start by telling them, did you know that this is actually a policy that advocates for you? So now we are speaking from, don't do this, okay, if it's done, then do this, but then if it's really important, then do this. So any parting thoughts you would want to share?
I think we kind of had everything, but I just wanted to congratulate you and really push you forward. I think what you're doing is really amazing, and I hope your listeners can be advocates for more access to healthcare services, and also for them to start, being more conscious about their health and doing regular check-ins.
Right. Thank you, Aline, for enlightening us on this topic of sexually transmitted infections and for joining me as we discuss the legal aspects surrounding them. Now, this conversation highlights the importance of breaking down barriers, promoting awareness, and empowering individuals to seek justice and access to proper healthcare. So, thank you for taking part of it.
Thank you.
As we conclude this episode, I encourage our listeners to actively engage with us by sharing their thoughts, questions, and personal experiences. Together, we can create a society that supports survivors, challenges societal norms, and promotes positive change. Once again, I extend my gratitude to our listeners, supporters, and our remarkable guest for today. Your involvement makes this platform possible. Stay tuned for our next episode, where we will continue our exploration of reproductive health in Rwanda. Thank you for tuning in to The Fireside with Jade. Remember, you belong here if you look forward to igniting change and creating a more inclusive world. Don't forget to subscribe to our podcast and follow us on all our social media platforms to stay updated. Until next time, take care and keep the conversation going.